ครับผม
Okay. That's okay. Okay. So we've heard negotiations in the past few days, past week, past couple of days, and we have heard much about the GGA, the Lima work program, and you know there have been some moments of disappointment, some moments of, heartbeat. But let's hear from Diego De Leon from Out for Sustainability, who's also been following these conversations pretty closely, who will be giving us a lowdown on what has been up with the GGA, the Lima work program, in terms of process negotiations and where we're going to move forward with how we see opportunities for SRHR. So Diego, over to you.
Thank you so much, Minka, and to the organizers of this event. It's a real pleasure and honor to be here with all of you. So as you probably or hopefully have read through the ECHO articles that have come out throughout the week, as well as a couple of articles that have been circulating through international media, there is a very important discussion going on currently here at COP29 regarding the revision and update of the Lima Work Program. The Lima Work Program on Gender and Climate is, as its name suggests, a kind of a roadmap that parties agreed 10 years ago during COP14 in Lima, that indicates what are the priorities in terms of countries to work on the matters related to gender and climate. After the adoption of the Lima Work Program came the Gender Action Plan, which is a set of activities together with its different objectives and priorities in terms of what are the specific actions that countries will be carrying out for a period of 2 years, then 3 and 5, until its conclusion at the beginning of this year. So on that, a lot of parties have been pushing in order to, as the name suggests, enhance the Lima Work Program, meaning building on the original work program and trying to find something that's better adjusted to the times, to the needs, and to the challenges that we face collectively, both government, civil society, and other relevant stakeholders. There has been, these discussions have been happening all the way from the SB meetings up to COP. And we currently have a document that unfortunately has been bracketed from beginning to end, and the text possesses multiple options in regards to what are the specific issues and actions and priorities that countries are hoping to focus on this new version of the Lima Work Program. Which will most likely have another period of an extension of 10 years. So as of today, and consultations are still happening, there are particularly 3 items that, or 3 topics that have been the most contentious. The first one is finance. So of course there is the push, particularly from developing countries, in order to increase the flows of international climate finance in order to support the activities that will be carried out within the Lima Work Program. Developed countries have provided some concessions, although the expectation would be to better utilize existing climate finance alternatives, the Green Climate Fund or the Global Environmental Facility, and encourage parties to access or use that finance for specifically gender-related projects. The other 2 topics is human rights, particularly focused on the protection of human rights defender, women and girls, and ensuring that whatever action or activities come out from the Lima Work Program protect and safeguard the human rights, again, particularly of women and girls. And then the issue on intersectionality, which for those who are not necessarily familiar with this term, refers to the multiple ways in which a person can be affected by climate change or can be benefited by a specific policy, talking about for example, it's not just women and girls, but also thinking about their potential disabilities, thinking about their race, thinking about their ethnicity, thinking about their migration status, thinking about their sexual orientation, their gender identity. And so it's addressing not only women as a single block or monolithic structure, but rather how can we understand the diversity that exists even within this population. And then, of course, the how do we address the issues, particularly regarding discrimination, based on some of the factors that I just mentioned. So there is currently a lot of pushback on particularly the language regarding human rights and intersectionality, but there are also countries that continue working. And then just really quickly on the global goal on adaptation, as you know, there is currently an expert group working on the indicators that will address or help measure the different priority areas of the goal. From the last SB to today, they were able to narrow down the indicators to 900. So now during the COP, parties are trying to provide additional guidance to the expert group on what are these, how to narrow down even more this indicator so that it turns out to be something that's manageable and measurable by countries. And of course, there is a whole section on health. So again, inviting everyone here to follow closely those discussions and see what are those that are particularly relevant to sexual reproductive health rights. Thank you.
Thank you, Diego, for that amazing summary. I know that time was short, and we could have heard more from you, but we will be opening up a question and answer series at the end of the program, so we can hear more from Diego during that. We will now move on to 2 videos, and before we go to that, one of the things that I'd like to iterate is the climate conversation transcends beyond just the UNFCCC space. And that shows us the significance of the issue that we have at hand when it comes to climate change. And this year we saw particularly a great interest coming out of the Human Rights Council space as well when it came to climate change as an issue on the intersection of many other development issues. We saw 5 reports from UN special rapporteurs that came out on different thematic areas around climate change. So we have 2 such special rapporteurs joining us via video who have given their video messages in relation to intersectionality and sexual and reproductive health and rights and its importance, who had given their reports and which were tabled in the 56th and 57th sessions of the HRC this year. So first, we'd like to play a video from Dr. Surya Deva, who is the UN Special Rapporteur on the Right to Development. And we are very pleased to play this message from him to you. So here we are.
Hello, everyone. At the outset, I would like to thank the organizers of this side event to COP29 for inviting me to speak at this side event. I'm recording this video from Honduras, where I am here on a country visit. And during this country visit, what I experienced is that the climate change is significantly impacting many people in Honduras, including indigenous peoples. 2 days ago, I had a conversation with several members of the community in Juletica. And one woman explained to me that she has lost 2 of her houses because of sea level rise. We also learned about a primary school is being taken over by the ocean waves. So the impact of climate change is very real, and it is impacting everyone everywhere. However, the impact is not experienced by people and countries equally. Women, children, persons with disability, migrant workers, indigenous peoples are going to be impacted disproportionately by climate change related loss and damage. Similarly, many countries are going to be impacted very, very differently. And I think that is where this idea of a justice framework is going to become quite relevant in the context of climate change. So it's not merely differentiated impacts, but it is also disproportionate contribution to climate change that is also a concern. Because developing countries, small island developing states, and least developing countries, they have contributed very little to where we are at this particular point of time in terms of climate crisis. And I think that is where my report on climate justice articulates a framework with 4 pillars. Of course, we talk about mitigation and adaptation in relation to climate change, but we ignore the importance of remediation. So I have argued in my report that we should see loss and damage in terms of remediation, but in addition to remediation, we also need a transformation. We need a new model of economic development which takes into account the planetary boundaries and which considers the needs of everyone, not just human beings, but the nature general. In this report, I also articulate 12 overarching principles that should have a bearing how different decision makers take into account the impact of climate change. And one of those principles is intersectionality. So I very much hope that decision makers will start considering those factors, whether it is about differentiated impacts, or it is about the principle of CBDR that is relevant, or we're talking about just transition. And I think we need more resources. And those additional resources have to come, in my view, from innovative sources of financing as well. That is where taxing the super rich, who have also contributed to the climate change significantly, is very, very important. And of course, we need to ensure the climate finance does not make the current public debt of developing countries worse. Thank you everyone for this event.
There we are. We heard from Dr. Surya Deva, who's the UN Special Rapporteur on Right to Development, on his message. And indeed, whether we are in Honduras or we are in Bangladesh or Nauru, the reality of sea level rise is glaring and is affecting all of us who are in countries which are surrounded by seas and oceans, but climate change is just not succinct to countries which are surrounded by oceans. We also see landlocked countries like Nepal, who also are facing climate change. And we will hear a case study from Nepal in the next segment of this event. Our next audio message is from Elisa Morguera, who's the UN Special Rapporteur on Human Rights and Climate Change. And we will now play the message from her, which looks at intersectionality and the importance of intersectionality in climate conversations.
Hi, my name is Elisa Morguera. I'm the UN Special Rapporteur on Climate Change and Human Rights. I'm sorry I can't be there with you in person today, but I'm looking forward to hearing how you may be discussing the findings of my first report to the Human Rights Council on intersectionality in the context of climate change. After 30 years of climate action, the negative impacts of climate change have been experienced by human rights holders in vulnerable situations and in vulnerable countries for over a decade, and are now increasingly being experienced by everyone on this planet. These impacts remain experienced unequally due to the interconnected situations of vulnerability and multiple grounds of discriminations. Thanks to the work of international human rights processes over the past 5 years, we can, however, now consider intersectionality in the context of climate change so that we can prevent the more discriminative impacts of climate change and certain climate response measures. Read together, the guidance produced so far by several UN Special Rapporteurs and other UN experts on human rights supports states in understanding and developing approaches to climate action that can more effectively protect children, women and girls, LGBTQI+ persons, indigenous peoples, peasants, small-scale fishers and pastoralists, people of African descent, persons with disabilities, persons with albinism, older persons, migrants, internally displaced persons and receiving communities, and other individuals and communities that find themselves in the context of climate-induced mobility, as well as persons in situations of extreme poverty and armed conflict, and those experiencing racial and ethnic marginalization. My report underscored that states and others should recognize the lived experiences of human rights holders that have been the most affected by climate change as distinctive and relevant sources of knowledge and expertise. And this in turn means that states need to ensure genuine opportunities for human rights holders in situations of vulnerability to participate in decision-making processes on climate change at all levels. States, therefore, need to take into account evidence and experiences on intersectionality in developing, implementing, funding, monitoring, and reviewing climate action. And they need to recognize and work with organizations that can offer the evidence, tools, and know-how to help consider intersectionality. The health community can be an essential partner in this endeavor, and I look forward to hearing about your deliberations about their contributions to diverse, resilient communities in interconnected situations of vulnerability and multiple grounds of discrimination.
Okay, that seems to be it. So that was Elisa Morguera, who's the UN Special Rapporteur on Human Rights and Climate Change. And, I'd just like to iterate one of the recommendations we heard in the audio, which was around states to provide genuine opportunities for human rights holders to be part of decision-making process, which is a very important recommendation that has been made by her. And we've also seen that in the report that was tabled earlier in the Human Rights Council. So moving on from HRC processes, we will now move on to a very important part and a very important segment of today's event, something that the coalition and its members have been working on for the past few months in preparation to COP29. And we are very pleased to share with you the findings of the advocacy brief on sexual and reproductive health and rights, which is integral to climate and health response. So I know I mumbled and jumbled that title, but I'm sure Naida will be able to elaborate further and bring us to track with that. So very pleased to launch the advocacy brief on behalf of the SRHR and Climate Justice Coalition. So Naida Alboni is from the Women and Gender constituency. So Naida, the floor is yours. Thank you.
Thank you so much, and thank you so much for everybody that's worked on this brief and worked on really addressing this critical issue, particularly when it comes to not just the gender and gender considerations and the gender action plan in the context of the negotiations here in the UNFCCC, but also when it comes to addressing the intersection between health and climate, including climate policy, climate action, and preparing to effectively respond to, health-related impacts and SRHR-related impacts when it comes to the climate crisis. And to give a bit of context on why particularly this is so important to me and why also the SRHR and Climate Justice Coalition focuses on this is that when you are focusing, as somebody who comes from a background that focuses on gender equality, I only later joined or became more active in the issue of SRHR 2 years ago with the Women and Gender constituency and the Sexual and Reproductive Health and Rights and Climate Justice Coalition. And once you become really understanding of what this means, and not just in policy and theory, but also on the ground and on the lives and impacts of women, girls, and gender diverse people and LGBTQ plus communities and marginalized communities, is that it is such a key point to life, being able to live a life that is healthy, that is of dignity, to be able to fulfill those fundamental rights. It's a fundamental pillar and cornerstone of being able to not just live, but also go beyond and have a life that you're able to live in your full potential. That includes access to education, that includes access to economic opportunities, that includes ownership and autonomy over your life and your decisions and your body. And it's such a fundamental pillar that needs to be integrated as a cross-cutting issue, because when we look at gender, oftentimes barriers that are faced have to do with SRHR. For example, early marriage, forced marriage, that has lifelong impacts of access to education, economic opportunities, which is also connected to the climate crisis. When we speak about adaptive capacity and resilience to climate impacts, it's also about having the structural enablers that allow you to be able to respond and effectively mitigate these climate hazards. So if you're hit with a flood, so if we're going to speak about rapid onset events, then your capacity to be able later on buy menstrual products to get contraception, also to have food security, which is tied to an issue of land rights and ownership. But also when it comes to slow onset events, so like droughts, heat waves, not only does it directly impact health, the bodily health, when we're talking about pregnancy and birth outcomes, but also your ability to build resilience in that without a lack of access, for example, to land or ownership over land, or without access to credit and capital, then you don't have the means to do simple things like buy food or buy water, which is often the case that happens in when these onset events happen. And to get more into the topic specifically, and I'm so happy that Diego went beforehand to illustrate the intersectionality of impacts and how your experience of these impacts or effects are really dependent on your circumstances, dependent on your identity, your background, your economic status, where you're living, and not just global south, global north, but rural versus urban. And so if we're going to define what sexual and reproductive health is, it's beyond just not being sick, not being ill. It's about really having a life, a healthy life that is full and that you're able to live your full capacity. And that is very dependent on having access to services. And this is a comprehensive set of services, which includes comprehensive sexuality education, being able to understand and aware of what's happening in your body. Coming from an area where that is very lacking, we have situations where women and girls and gender diverse people, they may start menstruating and they don't know what it is, or they don't know how to deal with it, or it's so shameful that they end up not going to school every month for a week, and that severely impacts their access to education, the quality of education they end up getting. And also to do with more things that are often neglected, which has to do with like reproductive health, reproductive cancers, that is often undermined, and also STIs, HIV, and making sure that all of those are, this comprehensive set is included. And it also includes fundamentally things like addressing and having systems of protection and response for sexual and gender-based violence, which we know is an unfortunate, very common issue, and it only gets worse with the climate crisis. So to give a bit about the health brief that we've developed, which by the way is available in French, Spanish, English, and Arabic. We developed this to clearly outline that, SRHR is a health issue, fundamentally a health issue. It is in nature a multidimensional issue, and it's also fundamentally connected to socio-economic determinants, the social determinants of health. And, there are clear health impacts, direct health impacts that have to do with, for example, pregnant women, as I mentioned, increased heat, water intrusion, as you will see in the brief, that we have direct coast and life experiences of, for example, floods that become polluted, and the access to safe water become reduced. So then they end up having to use polluted water, which impacts their uterus and their reproductive health severely, and then they get infections. So not only are there direct health impacts and clearly outlining that, this is fundamentally a health issue and must be addressed and planned for and responded to. But also it is, as you know, health is also a social issue, and it has to do with disparities and connected to the intersecting identities, and also where you're from, where you're living, your socioeconomic class, your race. So the climate crisis in general, it takes these disparities and inequalities and it worsens them. And we've spent so long trying to address it, and now we're at the threat of all of our progress being backtracked. And this is particularly true when it comes to for example, availability, accessibility, acceptability, and quality of sexual and reproductive health services. For example, the most clear example could be when disasters are hit, infrastructures are destroyed, access becomes disrupted, and, worsening access also to safe water, to SRHR education, which is crucial in informing people how to plan, how to take care of themselves, how to be able to identify when something needs professional help and needs you to go to a health professional. And also, of course, economic opportunity. And it also impacts menstrual health because it impacts economic opportunity and livelihoods. We see an increase in menstrual poverty. So here it's emphasizing that if we're not talking about SRHR when it comes to climate action, when it specifically comes to the health and climate policy and action, then we're not addressing the full picture. We're not helping people build resilience. We're not addressing the entirety of health impacts. It is integral, it is fundamental, it is, in its name, it is a health issue. And what's been emphasized that the climate crisis is a health issue. And if we're not addressing this, then we're going to find that these disparities, the well-being of people is only going to increase and get worse with. And not only does it impact service delivery and infrastructure, but it also impacts choices and abilities to make decisions about your body, about your sexual and reproductive health and rights. And this includes, as we see, and we've seen in many cases, that it increases sexual and gender-based violence and human trafficking, which of course leads to STIs, HIV, unintended pregnancies, and also unsafe abortions in contexts where, the access to safe abortion is not there. So the compounded impacts intersect and they worsen each other. And it's not just in the case of disasters, but we also see that, when coping mechanisms, for example, if there's a drought or there's salinity of land and agriculture produce reduces, we find that families, to alleviate economic pressure, end up marrying off their children at very young ages. So early forced child marriage increases, which of course comes with its own set of problems, not just early pregnancy from a purely health perspective, but also about limiting their capacity later on to pursue education, to pursue economic opportunities, to really fulfill the issue of having a life that's full of opportunities, dignity, and well-being. And then also we see clear negative coping mechanisms, like you have cases where because of the impacts on livelihood that women are resorting to hysterectomies in order to keep working because all other options are being limited and this is their only option. So it is such an intersectional and multidimensional issue, and if we do not effectively address it and provide enabling conditions that allow people and all their diversities to access and fully realize their sexual and reproductive health and rights, then it's only going to backtrack everything that's going to be done, and it's going to fundamentally reduce the health and well-being of people. And specifically, when we speak of addressing this intersection, it is sexual and reproductive health and rights is also an issue of justice, as was introduced by one of our fellow speakers. And in the sense that, already the access to health is determined by your background and your intersecting identities. But on top of that, the framing of what needs to be done. So this narrative that focuses on family planning, that focuses on limiting population through only the sole platform, it ends up leading to not addressing the core issue, which is not only ensuring that these rights are realized and that SRHR delivery is there, but also by redirecting the attention from the polluters, those who are driving the climate crisis, but putting the burden on often those in the global south with high population numbers and resulting in trying to control their bodies instead of focusing on how can we make sure that, first of all, the climate actions is ambitious and effective enough to ensure that we do not have to resort to building large adaptive capacities, building resilience, because that is part of putting the burden, is that when there's not enough climate action, then we resort to having to build this adaptive capacity and resilience, but also by not investing it in universal health coverage and investing it in sexual and reproductive health and rights. And I know I'm running short on time, and I really just want to cover a few things that we can take away from this as people in the room and in the space, is that what can we do about it? And it's really a few simple things, which is, you can read about more, is talk about SRHR. Whenever you're talking to your negotiators or talking to health community, make sure our SRHR is in the conversation, make sure that it's integrated and addressed, and also make sure that universal health coverage is an essential thing. As we've seen with the COVID crisis, our health systems, our health workforce is not prepared, is not able to effectively respond, and we need to invest in strengthening our health systems in the sense of our workforce and making sure that they're prepared and informed and able to respond to climate impacts, including in disaster cases and including for marginalized communities that have less access to and have greater health disparities. So sorry for going you so much.
Thank you, Nada, for that. And before we move on to the next segment with our next set of speakers, I would like to iterate that if you can use the QR to scan and download the brief, the advocacy brief, and this is what the advocacy brief looks like when you download it. So please do have a read, and SRHR is a health issue, and incorporate it in your advocacy. And we will hear more from our next around how one of the things Nada had said was around that SRHR being a key point in life, and in our ability to live life in a full potential, and our ability to have autonomy to make decisions about our life, our body, etc. So I'll invite our next speaker to elaborate further on that, who is Eleanor Bloomstrom from Women Deliver. And Eleanor Bloomstrom from Women Deliver, and she would talk to us about the life cycle approach of SRHR. And from Eleanor, we'll then move on to Maria Antonia who will talk to us about the experiences of adolescent girls in Brazil. Maria is a law student and also a Women Deliver Young Leader alumni. And so we will have two speakers who will get the opportunity to speak around the life cycle approach of SRHR and elaborate further on experiences around SRHR and climate. So Eleanor, the floor is yours.
Thank you so much, Minka. And you may have seen a slide that passed by with Hira on it, our colleague, and she wasn't able to attend. So we're sorry not to hear about her research and experience on climate refugees and those linkages. So I'm Eleanor. I work at Women Deliver, and we're an advocacy organization that focuses on securing and advancing the SRHR and bodily autonomy, particularly of girls during adolescence, recognizing that that's a key period during girls' lives that has a huge impact on their future and often through many experiences that are outside of their control. We work through collective action, youth engagement, and convening, particularly in context of threats of the climate crisis. One of the things we do is aim to shift power into the hands of those closest to and living challenges of adolescent girls, which for Women Deliver is ages 12 to 24. And that's why I'm also excited to share my time with Maria in just a couple minutes here. So I'll just give a little bit of scene setting on this and how we're looking at it, and recognizing that the climate crisis really is an intergenerational crisis. And that's why we need to take this life course view to it, and that SRHR is not just something for people of reproductive age. We all have these needs across our life course, and of course they differ over time. And we recognize it's intergenerational because young people today will experience a 7-fold increase in extreme climate events compared to someone born in 1960. So it's a huge amount of increase of the harms, and you've heard from Nada so many excellent examples of what that could mean. And we see that this has impacts on the next generation, so it's cascading. But of course, youth are taking action, coming up with ways to address the crisis, and it's really impressive to see what they are doing. I think in this context, adolescent girls are especially susceptible to having their life choices restricted and their bodies controlled during that period of time, which is intensified during climate shocks and stresses. We know already that healthcare SRH services are limited largely due to social and cultural norms, taboos, third-party authorization requirements, parental consent, and sort of refusal in health service centers. Even where there might be access to care, it's often refused to people who are not of age. A couple of years ago, or really just last year, Women Deliver and Pop Council supported youth-led focus group discussions, so led by youth, with youth to understand in Bangladesh, Nigeria, and Guatemala some impacts on youth of the climate crisis. And I won't repeat, I think they completely reflect what is in the brief. But in terms of child early and forced marriages and unions, I think one of the examples that really struck me was in Guatemala. It was that girls were making supposedly a choice to move in with boyfriends in different villages where they felt they were safer from floods and maybe able to continue going to school. But in the end, of course, that's a negative coping measure, and it's no choice that any adolescent girl should have to make. They also saw a lot of impacts on health, menstrual health and hygiene, the challenges from heat, and of course the limitations on education then. And we know that girls are less likely to return to school once they've been taken out of school. And I think the one issue that we're trying to see more here in the UNFCCC is to think about care work and that burden, especially on women and girls in terms of fetching water and firewood and taking care of others, which will only intensify with climate. And just before I hand over to Maria, I also wanted to talk about the importance of meaningfully engaging with girls in all of this, ensuring that there's an opportunity for them to be in the lead, to raise their voice, but also the rest of us where we can amplify their experiences and leadership and expertise. And we need to do that together to build our understanding of how societal norms and gendered division of labor are really impacting on adolescent girls. And make some efforts to get to that finite level of data at the inter-household level and see what is happening really in gender and age differentiated setups. And then we've seen at UNFCCC some dialogues on children, which have talked so much about health, but what's the next step? Where do we take that? How do we operationalize it, implement it, put it into the policies here, ensure that there's financing behind more research and more leadership from the adolescents themselves. And with that, I'll pass to Maria. Thank you.
Thank you so much, Eleanor. Thank you so much for having me here, and it's a pleasure. My name is Maria Antonia. I'm from Brazil. I'm 24, and I was previously presented. I'm a law student in São Paulo in Brazil, but I'm coming from the north of Brazil, which is the poorest part of it. And it's really important to give a little bit of context in terms of where I came from and what I will talk about here. I will try to be brief. I will try to cover 3 main topics. That is my case experience, my personal case experience in advocacy for sexual and reproductive rights in my country, and the outcomes. And the third one and the last one, it's what I think it's what's next. What answer the question, what's next in terms of intersectionality between gender equality, sexual and reproductive rights, and also climate justice. I started my advocacy when I was 14 years old, and I live in the north, as I said, and we constantly saw that girls, especially Black girls, were not having access to basic items of hygiene. And one main thing that was not being discussed at the table of the decision makers were, well, menstrual hygiene items, because they say like, okay, poverty, we can put a little bit of, investment in items, but the term like hygiene or menstrual hygiene were never in the texts. So we started to see this as a problem because it was affecting us directly. So with me and other girls as a group, we started to claim and started to go to schools, and especially my school, to talk about the importance of having free distribution of those items in schools. And the context it was, I studied my whole life in a public school, but it was a military school. So we had more resources than other schools in my city and also in my country. So we plan to, improve and put little advocacy in other schools, such as private and public. And we were kind of well succeed. We had a lot of help from the government, also from NGOs. This is why I became a Women Deliver Young Leader, because of this initiative. And we made a movement that later on became a national movement that was about free menstrual hygiene items and their free distributions in public schools, because we were tackling the more vulnerable girls. And well, it was hard. The advocacy, being a young person, is really hard. People don't listen to you that often. So you have to do a little bit of effort for them to listen to you. But it will succeed. And in 2022, Brazil approved a law that said the free distribution of menstrual hygiene items will be held in public schools from all over the country. So now we have we have 24 million girls that have access to free menstrual hygiene items, which is a victory, right? It really is amazing. Like right now we have free distribution, we have them to have access. But then, as I said, second topic, the outcomes. Well, that was in 2022. And well, being an activist, you have always to keep on watching. So the law was approved, everyone was implementing, everyone was talking about, gender was just it was on fire, but we were not looking at other problems, because they put the menstrual hygiene items, they put tampons in the bathrooms of the schools, but they didn't teach the girls how to use it. They didn't provide water. So if a girl wanted to fight the menstrual poverty that she's passing through. She had to go to school. But then we had a problem that most of the most vulnerable girls, they didn't go to school because they had other problems. They didn't have access to water. They didn't have infrastructure in their houses. And most of them lived in rural areas. So it made it hard to attend school and made it hard for them to have access to this public policy. So then as an activist, we started to question, okay, so we fixed a problem. We have a very good policy, but it's not being effective. And how does this, it's also related to other issues such as they don't have water. And also the girls who have access to these menstrual hygiene items, they don't have where to put it. So they put it in open air soil. So it's like, it's not being recycled, it's denifying the soil. And we have another problem that is an environmental issue here. So how can we fix that? And that perspective of having another problem within the problem that we're already trying to fix was not well received from other people who were advocating for gender and sexual and reproductive rights, because seeing intersectionality in big problems, it's really complicated. Seeing climate and environmental justice in gender equality is complicated, because what we are bringing to the table, it's more problem, right? But we're trying to bring more solution to. So I decided, and then with my movement, I decided to see that this was a right that we were trying to get from the government and get from civil society, and we needed to make the right claims. And then climate litigation came in, because now as a law student, I was constantly seeing the rule of laws and seeing the rule of, regulations in lives of the most vulnerable people. But we are talking about a very specific topic that it involves lots of questions, but people were not willing to see the complexity of those questions. So in climate litigation, we were trying to see the gender aspects of it, and it is really hard to put these specific questions, such as the example of menstrual poverty, when we go to claims to the courts and say, okay, the last disaster that we have in Porto Alegre in the south region of Brazil, it was affected by the biggest flood in the history of the country. Many people were displaced, especially women. They didn't have access to anything, water, shelter, everything was gone. And we were on those claims putting that women need were more specific, but the government was not allowing it, and the judgments were not in favor of our claims. So to finalize my quick overview, and also to make the question and present a few thoughts about the youth and how we're dealing with that in our country, since COP20, like the next COP is going to be in our country, it's how can we enforce that we have the legal frameworks? How can we make sure that our claims are also being translated to regional and a specific narrative in social movements, but also in the government? How can we make sure that this intersectionality, it's something that is not just us discussing things and saying, oh, hey, intersectionality is really nice, and also we need to see climate justice as a gender issue, because it is, but how can we make that really to the people that are not here in this room? Because if you're here in this room, you're already willing to be convinced by me, but the problem is the people that are not. So I think what's next from my perspective, and thanks so much Women Deliver for giving me the opportunity to be here, is also to make pressure on people that are not here in this room. They're the judges, they're the policymakers, they're the negotiators, they're here to, take our claims into consideration. So that's what I think is coming next. So much.
Thank you. Thank you, Maria, and thank you, Eleanor, for your sharing. some very important points. I've written a whole page full, but I'll just try to read some. Eleanor on coping mechanisms, care, work burden, some important information there around that, early child forced marriage, opportunities of education attainment are all very important aspects of realizing sexual and reproductive health and rights. In Maria, lack of menstrual hygiene, vulnerabilities of doing advocacy when you're a young person, the importance of making the right claims, some very important points that you've made. Also, one of the things as you were speaking that I'd like to say here as well, you're not alone in the fight for menstrual hygiene for young women, and also having that available in schools, having that available to younger women. I come from Fiji, and we had a very similar experience, in the last decade doing that. We've also got similar wins, which we thought at that time were wins in terms of providing menstrual hygiene products in schools. And then we know those challenges. So I guess the road to Brazil has already begun, and we will hope to join you in COP30 next year. So thank you for making that intervention today, and we are pleased to have you with us. And before I move on, and thank you, Eleanor, for iterating that as well, I'd like to also bring the importance of Indigenous people from all over the world who are also at the front line of climate change. We were hoping to have a speaker who would have spoken about the experiences of Indigenous women who also have a report from Pakistan. So if you'd like to read about a research report that was launched earlier around the experiences of Indigenous women from 14 districts of Pakistan, you can log into Dastak Foundation's website. That same report is also available on Arrow's website as well. So please have a look at that. That also brings to light some very important experiences of women from Pakistan and Indigenous women, as they have a very diverse group of women who make up the Indigenous women grouping. We'll now move on to our next and final speaker. But last but not the least, we have Linking SRHR and Climate Justice Series and a case study from Nepal. So I'd like to invite Khushbu Paudel, who's from IPAS Nepal and also a co-convener of the SRHR CJ Coalition. Khushbu, over to you.
Thank you, Menka. Hello, everyone. I'm Khushbu Paudel, and I represent IPAS. I'm based at Nepal. IPAS works on safe abortion ecosystem and SRHR, and now from 2021, we have started working on the intersection of climate change and SRHR and gender in Nepal and beyond our country offices. Today, as I echo with all my former speakers and moderator, as the stories are similar to Nepal also, and the recommendation that has been shared by Nada through our brief. But today I want to highlight some work that we have been doing in Nepal in the intersection of climate change, SRHR, and gender. Could you please change the slide? Yeah. As you can see, this is the climate resilient SRHR framework developed by IPAS Nepal and all our work has been based on this approach in the field. The goal of this framework is to strengthen the SRHR system and to protect and improve the sexual and reproductive health and right of marginalized communities, particularly women, girls, and diverse population in an unstable and changing climate. It also aims to hold the stakeholders and system accountable and committed to sexual and reproductive health and rights and responsive to SRH needs of everyone. Based on research findings, pilot initiative on women-led climate justice, we have developed this framework to tackle the SRH challenges due to climate change in Nepal. We have adopted IPAS Sustainable SRHR Ecosystem Framework and WHO Low Carbon Health System Framework to develop this framework itself. The framework is based on the drivers of climate change, as you can see, and its impact on SRH and border health system. We have identified the resilient approaches in each of the components of health system, for instance, to make health workforce and service delivery more climate resilient, we have identified climate informed SRH program and climate smart health workforce. We support health professionals by providing them different types of training, including minimum initial service packages, rapid response teams training, health rapid response team training, and also provide them orientation and training on the intersection of climate change, gender, and SRHR, so they are better equipped and have enough capacity to respond to different types of climate-induced disasters in any kind of humanitarian context. Similarly, we also work in demand side, and in demand side, our focus is on women-led climate movement and agency building. We work together with women, girls, adolescent boys, and youth in the from the vulnerable and marginalized communities. We raise awareness. We train them so they can build their agency within their communities, and they can ask for their rights and services. And make their local government more accountable to provide easy access to SRH services and care that they need even in the context of climate change. Under vulnerability risk assessment and research, we have adopted comprehensive approach to assess the health system and communities using the SINDRA tool, and the tool stands for Social Norms, Poverty, Climate-Induced and Disaster Risk Analysis. This tool considers social norms, poverty, climate-induced effects, and disaster risk in any community to help us better plan in the context of climate change and SRHR in the future. This holistic analysis is crucial for understanding the underlying factors that contribute to vulnerabilities in both the health system and communities that it serves. In order to enhance climate transformative leadership and governance, we are collaborating closely with local, provincial, and federal government entities to leverage resources and expertise for building resilient communities and health system. We work with local government to prepare local adaptation plan of action, which is a 5-year or 3-year plan that is prepared based on the vulnerabilities and social risk in the communities. We have been preparing this plan by also integrating gender and SRHR, and we not only prepare this plan, but we also support the government to implement the plan, mostly in the area of SRHR. We also work together with local government in co-financing climate and SRHR initiatives in the communities. For example, we work together with one of the local government to conduct a reproductive health camp in the community. Prolapses was the highest, and after that camp, 20 referrals were sent to the hospitals because of very extreme cases of uterine prolapses. Similarly, we also supported, or we worked together with local government to build an outreach health clinic in a strategic location where the women had to walk around 3 hours to reach to the nearest health services, and they were banned in accessing even simple services like contraception, abortion services in the case of climate extremities. So we supported in building outreach health clinic, and now they have better access to basic services like contraception, vaccination, and other SRH needs. Overall, this climate resilient SRH framework is a holistic and integrated approach that leverages existing frameworks, research findings, and pilot initiatives to address the complex challenges at the intersection of climate change, gender, and SRH. Implementation of this framework has the potential to enhance the adaptive capacity of health systems, promote gender-responsive approaches, and ultimately improve the health and well-being of communities in Nepal and beyond if applied in other contexts also in the face of climate change. Can you second slides? I want to share a story, a small story from Nepal in our working area. And as the person in the middle, he is the ward chairperson of one of the working area in Nepal. He states that recognizing the interconnection between sexual and reproductive health and rights and climate change, we have taken the initiative to incorporate this concern into local climate adaptation plan of action. By doing so, we have ensured that the municipality has a comprehensive understanding of the challenges faced by the community in relation to sexual and reproductive health and how these challenges intersect with climate change. This integration has provided us with valuable databases and information to inform future planning and decision-making processes. So he has been very supportive and has included in his action in his local evaluation plan of action the SRHR agenda also, and have been implementing not only mainstreaming or integrating those agenda in the plans, but also supporting and putting budget every year in these interlinkages. Like after this initiative, he also he provided many safe sanitary pad making training for adolescent girls in his plan. So this is a small step, but I think a big step on the intersection of climate change and SRHR. This was, as is spoken by this person in a rocky area, echo the spirit of partnership and innovation that defines our approach at IPAS Nepal. This commitment not only highlights the urgency of addressing climate change, but also highlights the imperative to integrate sexual and reproductive health and rights into the broader discourse of resilient health system, and I better say climate resilient health system. Thank you so much.
Thank you, Khushbu, for that. And there we are. We've heard from some of the amazing work that IPAS Nepal is doing in districts in Nepal, and some analysis tools highlighting the vulnerabilities of health systems in the face of climate change. We've also heard about local adaptation plans, something that is very important to localize in diverse countries where communities are very diverse to each other from one end to the other. So also having, secondary level localized adaptation plans, very important, and also around the reproductive health camps. So thank you, Khushbu, for that sharing from Nepal. We'll now move on to the last part of the event today, where we'll hand the mic over to you all. So if you have any questions or comments, please feel free to share now. Opening the floor to the audience. Get you and then yourself back. You can go. Yeah. Is there yeah. So we'll get her, then yourself, and the gentleman at the back.
Thank you very much for really interesting discussion and the reflection and sharing your experience, what you are doing in the ground. So once you sharing all of those things, I was thinking about back in my country also. I'm reflecting like the same experiences, particularly once you're talking about the intersectionality. So I'm from Sri Lanka, and I'm also working with the rural women, particularly women farmers as well. So it's same, like once we get the women in the plantation sector, particularly who are like contributing to the tea industry in Sri Lanka, but they have very minimum resources, like as you say. So I was thinking like, how can we reflect and how can we bring this concept as a demand for this concept of the polluter should pay? Because, like in Sri Lanka and other countries, I think it's like all the things, all the resources that should be allocated to sexual and reproductive health, it goes through the public money, right? Because of the climate situation, climate crisis, it's the public in the same country, they pay the tax, then government, because in countries like Sri Lanka, we have a free health system. It means we need to give paper, medicine, and other health necessities in free of charge, some of them. So then it's all about like our money. So can we bring this to this? How can we because I don't hear that is much emphasized in this polluter should pay the money, that concept. So I would really love to hear from you if you can, how can we expand this as a demand? And how can we bring back to the countries like us and our government? Sure, how can we push our government to address those issues, those intersectionalities in this theme. So I would like to hear from you.
I think we take all three questions first, and then we'll have the panelists answer them.
Yes. Thank you very much to all speakers, especially for sharing, because I come from Madagascar, and it is a very poor country, and all you have said, we live it. Girls and young women are really facing problems due to climate change impacts, especially the non-access to education, non-access to clean water during their menstruation. So it's and it's all it is still a very hard action to sensitize people about it, because girls and young women are devalued in front of men in Madagascar. So my question is, do one of you already face this situation? That means the feeling of being devalued in front of men, and what have you done? And yes.
Yeah, thank you, speakers. My name is Amkodi Seras Kabale. I'm from Uganda, Africa. I think the speakers, what they have shared about the climate justice and SRHR, they're not different from what are also going through in our country. In Uganda, we have a project, we have the oil projects in Uganda, where they closed our schools in our communities for over 10 years. And the girls were not going to school, they are married off at the age of 10. So I'm looking at this situation here where we are forced, where they constructed for us small houses and we are sleeping together with our parents. Yet in our culture, we are not allowed to sleep with our parents so long as we're at the age of 10, at the age of 12. We aren't supposed to sleep in the same houses with our parents. But because of this oil and gas project that came into our area, we are forced to sleep in the same houses, which is contrary to our culture. So I'm looking at this platform here. How can we expand the skills we are getting from this this platform here? Because I saw one from Nepal where they're also advocating, they're pushing their government, so the government is responding. I'm seeing that there's also a gap, or there's a need in our country also to have a movement that can have girls raising up so that it can push our government and oil companies to respond to our needs. Thank you. And also the last thing, how can we also join the coalition? And also coalition also work in our country, like Uganda. Thank you.
I think there was one more question. Oh, we have several. Okay, then we'll go for the next round then. Maybe one panelist each so that we allow the further questions. So the first question from Sri Lanka was, how can we bring this concern on SRHR as a demand to decision makers, especially using public money? Yep.
I think I would address this question with a current discussion that's happened at the international level. As you probably know, there's currently a discussion on an internationally legally binding to end plastic pollution. This came as a result of 2 years ago from the United Nations Environmental Program Assembly that mandated or required countries to develop. And one of the principles that have been that countries, particularly in the developing world, have been pushing is the polluter pays principle, because of the impacts that plastic pollution has on population, which of course includes health as well as particularly sexual and reproductive health rights. So I think that, to your question, how can we bring the governments on this type of, so you have the international space where international discussions, you can bring this specific discussion. US civil society can demand countries to act upon that and to include them in international treaties. And of course, back at national legislation. Once these international instruments are agreed and the next step is for countries to ratify them, then the work kind of passes on to the national and local level. But that I think, particularly for the polluter pays, that's going to be a very important issue that's currently ongoing, and that will have the next the next and last negotiation is next week in Busan, Korea. So a lot of the countries, delegates that are here are going to be traveling to Korea to finish those discussions. And then ideally the treaty is set to be finalized and signed next year. And then the goal for it, or the timeline, is to end plastic pollution by 2040. So it's about 50 years that countries are going to have to address that topic.
Thank you, Diego. And we'll move on to the next question from Madagascar on the situation of women feeling devalued. And any one of you who has any tips around what you have done in terms of that. Yes, Khushbu.
So I want to share that even when I started my work 2 years back with IPAS, in a forum of climate people, though I also come from a background, when I shared that I've started working with the IPAS and we work on abortion ecosystem, then they would talk to me back. There are like 2-3 cases, would never talk to me back. But then, but still, what I feel that we are fast forward now in our position paper. If you see the position paper of Nepal on gender, then you can see SRHR is reflected. That means you don't stop talking about it. You continue talking. You continue talking about it. You don't stop talking about SRHR. You do the research. You have evidence. You do the program, and you build evidences, and then you talk about it with some evidence. If you back up with some evidence, then I think no one can stop you from going ahead. And then in one day, it will definitely come into policies, programs, and then really into the field. Yeah, that's my experience. Thank you.
Thank you, Khushbu. I just wanted to add one thing there. I've worked in an organization where we wore T-shirts which said, "We resist, we persist, we insist, and we exist." So that's what we need to do. And the question we had from Uganda was on how can we advocate the government to push and demand for rights for adolescent girls. Any one of the panelists? Eleanor?
Well, I think first is to make sure that you are sitting down with adolescent girls and really engaging them and supporting the capacity, because they, of course, are experiencing all of the infringements upon their rights, but probably need some help with a pathway to access the decision makers and make sure that it's their voices leading on everything. I think it also takes a lot of groundwork to understand some of the linkages, which you may well already understand, between the local to the national level, and following budget lines, I think, is another way to really engage, because there may be policy, but if it's missing the budget, then we won't see that change. But I think continuing to insist, like we've just heard, insist on that space and carve it out and provide that support and seek solidarity and collective action, things like the coalition and other spaces that can support that. And there's learning to be had among coalition members, for example, of what has worked or where the challenges have been.
Thank you, Eleanor. We will take a next and final set of 3 questions. I think we had the 2 and the gentleman here who had put their hands up the last time. So sorry, we're running out of time now.
Hello, my name is Sabina. I am from Azerbaijan, and I wanted to ask you, as much as we talk about the government and what they can do to help young women, it's also, I think, a question of collective responsibility that we all have. And what would you advise the people to do locally, maybe? What we as individuals can do to help on those issues? And another question, since there's a lot of young people on this panel, what would you advise for the youth that sometimes may feel discouraged because something is taking slow or not everything is working out? What would you advise for them? How not to lose hope, how to still have this motivation to keep going? And once again, what we all can do in our individual things to feel like there is something that we can do, not to feel, unmotivated. Thank you.
Hi, my name is Luiz. I also from Brazil. And my question is if in your country you have a care policy and how and where they are building.
Just to elaborate, you said care policies, right? Care.
Thank you, Tala, and thanks for the panelists. I am part of the coalition. Probably I'll give an opportunity to others to ask, but I felt we need to reflect a bit. SRHR, gender equality conversation have been on, even before the prominence of health and the climate, with the different actors, and in my view, there has been the unlocking of SRHR into the climate agenda has informed, of course, the current conversation we are having, amplification of health and climate. But again, we are still thin, even within the health and climate discussion. I'm not talking about health, SRHR and climate, now in the health and the climate discussion, and that is a serious issue. We need to try to kind of have a conversation on that, probably not even this forum. But I must thank the coalition and the members, because what has been disturbing our advocates at national level, regional processes, has been issues like messaging, the wording. So I am so happy that some of these guidelines are out there for members to use and engage. But I just feel that we are not doing enough at country level. When you look at the negotiation text, I've been moving around, check out country positions for negotiators. You hardly see the section reproductive health rights in the text, apart from countries like Uganda. So in my view, even as we're having these conversations, we're back home, we need to be taking low-hanging fruits like the revisions of the NDCs that are going to be submitted next year. We need to see some of this conversation hitting into those national agenda processes, because we need to have so many countries support this intersectionality so that we are able to ease our way at the global level, but also the NDCs and other processes, including pre-COP, post-COP negotiation too. For me, the national processes matter a lot. And I'm happy that countries like Nepal, Madagascar, PH, Ethiopia, and others are doing great work on that. We need to see the momentum that other conservation agriculture colleagues are using. If they want to push agroecology into the text, the alliance moves like a wind, like everyone is on the move. We should not be so silent as health folks, gender actors. We just need to have that kind of vibrance, and already we have now the coalition which can guide some of these processes. So mine is to try leave this comfort zone. We seem to be a little moving slow. We want to be there. We are not there. The evidence is growing. We have enough data. We have enough facts across countries to put up something formidable.
If you have a question and if you can ask that and wrap up, we'd like to have time to.
Mine was just a general comment.
Okay.
Yes.
Thank you. Thank you for that. Okay, so we can go into answering. The first one from Azerbaijan was on advice to do locally as individuals, and especially advice from youth. So for those panelists who haven't answered yet, Maria, yep.
Okay. Thank you so much for the question. I think it's a question, almost existential question that I do every day when I wake up and every day when I go to sleep. Okay. How, like personal opinion, I think it comes from collective action. Like you're not alone. And you have to have that on mind. And this is why we have collisions. This is why we have movements. This is why we have conversations. This is why we're not just like sitting alone and like making the decisions, because we need to talk and we need to exchange. So I think the way that I stay motivated and don't feel pessimistic about the decisions in international and also, as the gentleman said, like in the domestic level, is that I don't feel that I am alone, because I'm in constantly contact with other people that are doing amazing things. And also having in mind that it is a big problem. It is. It is a big problem in the domestic level. It is a big problem in the international level, right? It's hard to put everyone on the same table to, well, discuss the same problems and see that this is a real problem that we need to target, and we don't have time. But also, as she was saying, data is really important. And I don't think we have enough data. We have a specific data for some specific points, but now we need to improve and make more specific questions, for example, such as what number of indigenous adolescents have having access to, oh no, in my example, menstrual hygiene items. We don't have that in Brazil. We don't. Now we're pressing the government to do that. And also, another tip is like, don't rely that much in only one source. Like the government is one thing, but we have also international organizations. We also have social movements. So like putting your eggs only in one plate is not a wise choice. I learned that since I was 15. So, well, yeah, if the government is not aligning with you, we can go to international organizations. If the international organizations are not doing their work well, you go to social movements. And like the dance and the beauty is like they communicating to each other. And that's what makes me not feel sad at all, because I feel like I can navigate through these like sectors, and I think the youth should navigate through them. So yeah, that's my advice.
Thank you, Maria. The next question we had from Brazil was around countries with care policies and how can you be effective in implementing these care policies. Any one of the panelists? Yep, Eleanor.
I can't really speak to specific care policies of countries around the world. I'll flag one thing. Was a recently published global roadmap on action for care that sets up some indicators to try to track where are there care policies that could support resilience. It's not specifically related to climate, but it has an aspect in there. So looking at where are there parental leave policies, elder care policies, finance towards different aspects of care policies. And so I think that's a good way, speaking of the data and sort of metrics, to track what's happening. And also a job for all of us to do is to make sure that we aren't only looking in the climate space, but we're seeing where are these other policies. So I really appreciate that question. And just to go back to finance, I think another aspect of that is to recognize that we need to get the polluting countries to pay up and to make their contributions to these funds. The funds exist. A lot of them have gender policies. There are opportunities to put forward projects and proposals that would include these issues we've been talking about. So we need the money in there, but we also need the projects to move.
Thank you, Eleanor. And we had a last comment on health and climate conversations. And Nada, would you like to add?
Yes, just to kind of ground and bring back home of what we can do about it, and beyond just the UNFCCC process and the negotiations on an international level, but what we can do on a national level, as health advocates, as members of the health community and the health workforce, as gender advocates, as when we go back home, what we can do is that now, as was mentioned, that the NDCs are being developed, NAPs are being developed, and not just NAPs, but health NAPs are being developed. So trying to be part of these conversations and also talking about SRHR and making sure that they're integrated as fundamental components of these national policies are very important. And I think this is something that we can take home, because international is one thing, and of course it's important when it comes to, for example, how can we have the justice aspect when it comes to polluter pays. Like there's a portion of that, like the climate finance, but then we have to connect it to the ground of, okay, how can we implement this and make sure that our policies, our actions, our on-ground implementation is SRHR responsive, including all the intersectional aspects to it. So, thank you.
Thank you, Nada, for that. With that, we've come to the end of our side event. I know there were still some hands up and there were still some questions, so please feel free to catch one of us and have a conversation. We'll be more than happy to do that. Thank you so much, everyone, for making the time and joining us today for this event. We are very grateful. Please do check out the Sexual and Reproductive Health and Rights and Climate Justice Coalition, or SRHR and CJ Coalition, like we call ourselves for short. And yes, the information about membership is in our website, so please do have a look at that. And again, thank you very much, and thank you very much for to the speakers for making your time to join us today and share your experiences with us. Thank you.